Hello, my name is Brian Casey. I'm editor-in-chief of AmpMini.com, and we're here at the 2013 edition of the Radiological Society of North America. We have with us right now Dr. Paul Chang. He is a professor of radiology at the University of Chicago. Dr. Chang, thank you for being with us.
Well, thank you for inviting me.
Yeah. So, Dr. Chang, you've got some kind of interesting perspectives on what radiology is currently going through and kind of how the specialty is adapting.
Well, it's interesting. Many of us are familiar with the Kubler-Ross 5 stages of grief in any sort of traumatic event. You start off with denial, and then anger, and then bargaining, then depression, and then hopefully eventually acceptance. I think we're going through the same kind of process, slightly modified when it comes to radiology and radiologists dealing with this new disruption with healthcare reform and the uncertainty. Certainly there was first denial, like it won't affect us in radiology, or thank God I'm retiring and won't have to fight this. And I think we've gone through anger a lot. I think the third stage is a little different now. I think as I go through this meeting and talk to colleagues and look at the technical exhibits, I think we're firmly in the phase of gathering mind share and lip service. Not quite sure we've actually accomplished anything yet. I think we have a lot. We're just starting and we're just beginning this process. But certainly the buzzwords are there. I mean, if almost every vendor, every talk, you hear the words value, engagement, relevance, alignment, actionable, relevant. These kind of words, I think, speak to the fact that people are beginning to listen, are beginning to slowly accept the fact that our world is changing. And the question is what is the best strategy to address those changes, to survive and to provide the best quality care most efficiently and safely to our patients. So I think it's a useful phase. It's a necessary phase to do all the buzzwords and all this. I am less convinced, at least at this meeting, that I'm seeing real solutions. I think that's going to take a lot longer, but this is a good first step.
So maybe if we're not actually at the point where we're delivering real solutions, maybe we're at the step where at least we recognize what the problem is and kind of moving toward getting there.
Absolutely. Having a consensus and capturing mind share is always the first step. It's the vision statement, right? The vision statement is necessary. It's not sufficient, but it is a necessary step, and I think that's where we're going through. Now comes the hard work. Now comes say, okay, what is it that I can either buy, or how can I change the way I practice medicine to actually accommodate and address some of these buzzwords into actual strategies. Now, I think there are some themes that you're beginning to see, and one of the major themes is the uncertainty is the big thing. I mean, if someone told me exactly when the switch would flick on from fee-for-service volume to value, to where we become from revenue generators to cost centers, if someone told me when that would happen, a lot of the uncertainty would go away, and it would be very clear what strategic and tactical models I could adopt. The problem is we don't know when this is going to change, and certainly what's happened over the last few weeks with uncertainty with respect to healthcare reform and the ability to deliver adds to that uncertainty. So this transition may happen right away, it may happen years from now. So this is a problem, because if I move too quickly to change dramatically the way we practice radiology in anticipation of the move from volume to value, I'm going to suffer in many ways. On the other hand, if I'm too slow to move, I'm dead. So what I really think we're needing now, and this is where a lot of uncertainty is, I need a hedging strategy. It's very clear how to optimize fee-for-service. It's very, very clear how to optimize this alignment cost center strategy. Certainly as someone who does a lot of work in IT, we've been at cost centers forever. We know how to survive and optimize in that environment. The issue is, what is a hedging strategy that is fair and legitimate currency in both worlds? The world I live in today and the world that many of us believe is going to disrupt that world and move me to the new one. And I believe there are certain hedging strategies that I think we need to concentrate on. One acceptable hedging currency that's acceptable in both worlds is improved efficiency. And I think that's one hedging strategy and target that I would like to see more of the vendors talk about how can we improve the efficiency, not just in the reading room, but the whole cycle. I think a second strategy is we need to get back to the old days when we were the doctor's doctor, when we were in the reading rooms. Yes, it was inefficient, everyone had to come down to us, but we were the central beginning place for rounds. Everything was at radiology because we provided the dominant phenotypic evidence for patient care. Everyone came to us. Now, obviously, with PACS, we're not going to go back to those days, But in those days, we were relevant. We truly collaborated. We didn't just create through speech recognition reports. We truly collaborated with our colleagues. In fact, in those days, no one even read our reports. They didn't have to. We engaged every day. I think we need to embrace IT tools to actually bring us back to those days where we were the doctor's doctor that we could engage. So that's a second hedging strategy, to be invaluable by moving less in communication, like a message in a bottle, but more collaboration like it was in the old days.
Have you seen any specific IT tools here at McCormick Place that you think represent what you're talking about?
Well, you're getting me in trouble here. I'm not going to mention it. I think you're seeing some, maybe I'll say it this way. You're going to edit this, right? So I can.
No, we're live. We're rolling.
Oh, okay, sorry. So I'm not going to get into trouble by trying to mention specific names, but I do see some trends in some vendors. I think you're seeing evidence of people taking very seriously the concept of evidence-driven action, and those are two words: evidence and action. So you're seeing vendors understand the need for deep analytics. Okay, I still believe we're in our infancy here. I think much of what I see in the vendor offerings concentrate on analytics that can be garnered by aggregating information from radiology systems, when in reality, the real pertinent questions when it comes to utilization, and especially with respect to the enterprise, will require aggregation and analytics correlating what we do in radiology with the rest of the enterprise with respect to true outcome and utilization outside of radiology. So we're in our infancy, but I am optimistic that as I go through the technical exhibits, there are many vendors that are really taking seriously the idea that we have to measure and deeply analyze and employ business intelligence to what we do. And I think the other class of vendors that I'm seeing that I'm optimistic about, and again, they're all in their infancy, is the understanding that we have to go beyond simply isolating ourselves and concentrating just on messages in the bottle, where we just write a report and be done with it. But instead, really fostering collaboration, both synchronous and asynchronously, and you're seeing more and more vendors actually concentrate on that side of it, right? Trying to get us out there virtually, at least, in every reading room, every clinic, every OR, kind of like the old days when we physically did it in film, to embrace IT technologies to do that. And I think that's a positive, if not early, but positive sign.
All right, very good. Well, thank you for being with us today.
Thank you very much.
Signing off for AmpMini.com, my name is Brian Casey.